So I want to take it from admission to a treatment center, and uh, this could be an admission for substance use disorder, mental health issues, trauma, really any process disorder. So the person has agreed to get help, and let's assume you're taking them there, dropping them off, or they've been picked up, and it's kind of this first day, 24-hour period, and this is again a difficult period. Every period of this is difficult, and one of the difficult parts is that hi Luce, um, that you just don't know what's happening, right? Now there is some relief because hopefully, perhaps the first time, maybe not hopefully, but perhaps the first time you do know that your loved one is safe and you know where they are and you know they're being taken care of, and rest assured if they're in a place they are being taken care of, and usually better than they have been in a long time. They have eyes on them, and they're surrounded by care and support and attention, and they're being cared for like they haven't been in a long time. uh, doesn't mean it's easy. It's not easy. And just because someone surrenders to going to treatment doesn't mean, one, that they stay surrendered to the process, that it's an easy road, that it's all good from here. It could be the beginning of a really tough time. It could be the beginning of them wanting to come home. It could be all kinds of things can happen. But for this initial period, know that they're in good hands, that they're safe. If they're going for a substance use disorder, this is going to be called detoxification. And depending on what they're using, what they're there for, the process is going to take a couple days to be safe, let's say 7 to 10, just a very generalized estimate. But most treatment centers these days, they're going to be safe, in good hands, um, well taken care of, and you may not hear from them for a couple of days because they may be going through this medical process. Um, but you should feel comfortable calling the center, asking for either their counselor, therapist, or nurses station to find out how they're doing. And you can just ask if they're sleeping. That's important. If they're not, it's okay. It'll come, but um, and just how they're making it, how they're adjusting. And if they're having a tough time, just don't be alarmed. It's a tough thing to adjust to. It's really tough. And I've also said that having a tough time adjusting to rehab is a fairly healthy response to rehab. Um, the idea of just going into this institution where you don't know anyone and it's like old home week, that's a different issue. So the having a tough time, not knowing what to expect, not being trusting, being defensive, like that's not an unhealthy response. That's a fairly healthy response. Being homesick is a very healthy response to rehab. So I would look at that as positive things. Now, a, a couple days, the person will become integrated into the community. Just a couple days. And if it's taking longer than that, then I would suggest something else is happening. Either the individual is either unwilling or unable at this time to adjust, and this could be for a lot of reasons. It could be medically, it could be clinically, mental health, medication, um, all kinds of reasons that would prohibit the adjustment to the community. It could be the community. We don't blame the patient here. Um, it could be all kinds of things. But the important thing is to ask, right? And not make assumptions, right? To not, what I think is so easy to do is to just blame people for the symptoms they're seeking help for. And what a misstep that is. I mean, we're supposed to be helping them for these issues. So to truly meet them where they are, um, you try to assess and give them the help they're looking for. Um, it doesn't mean that they get what they want, because that's not helpful. That's why they got there. But you give them the care that they need at the level they are. Um, and so, as a loved one, you want to ask these questions. You know, how are they getting along? The other thing that you want to be prepared for is what I'll term, and it's not going to be a wholly accurate term. I'm just going to call it this. Is what's called a flight to health, meaning within a couple days you hear that they're doing great, and you hear from the counselor like uh, like what a good person this your husband, wife, child is. Like what a great man. Are they funny? Like wow, what a great. And you're like, I think we're talking about a different person. Like what a great person. Like and like that that's true, but you haven't seen that in a while. And you're like, well, wait a minute, was it me? Did they have to get out of this environment? Like, why are they showing you this, not me? Or, oh, you're seeing a facade, like you're seeing a liar. Uh, and both things can be true, right? Because obviously, coming into this environment, people are going to try to kind of put their best foot forward. But there's also this idea of coming into treatment, you are with a bunch of people that speak your language, are listening to you, are very present with you, understand there's this real support and this kind of band of brothers immediately because of what everyone's been through. And so there is this immediate, somewhat immediate vulnerability, transparency, accountability that leads to this heightened level of relationships pretty quick. Um, so while certainly there's manipulation and trying to get by and defensiveness and denial, it may not be all that. It could be a little combination. But as a family member, I would urge you not to take it personally of, oh, why are they there for them in this manner, but for me, they were just mean and cruel. Understand that this idea that we hurt the ones we love is just, it's factual because it just makes sense, because the ones we love get more of us. So I'm giving you a piece of who I am, not all of me. The people that I love that are close to me, they get all of me. They get this part of me that is full of love and engagement, but they also get the part of me that's really kind of moody and can get really sad and upset and hurt. um, and so that's all of me. So they're more open to be hurt by certain things, whereas the people on the outside, they just get this very little piece of me. They don't get this full experience. So that's why people that we love get hurt the most, because they just experience more of us, a fuller breadth of who we are. So that could be one of the reasons. So I say that because you may hear some things where you start to think of, well, I don't know what's so special about this place, because I've been telling them this for years, and all of a sudden they're acting like they just heard it, or why are they better now and they weren't here? And I just want you to take a step back and understand that you, they were sent there for the help they're getting, right? So this is the desired outcome. Um, and sometimes people just have to be in the right setting and hear from the right person. Sometimes whatever substances they're on need to be away, or whatever mental issues mood disorders need to be cleared away for them to get a clear path to clarity. I don't think that makes sense, a clear path to clarity. Uh, but the sometimes that needs to be kind of brushed away before they can hear these messages, and sometimes they need to hear from people that are peers rather than people they're in different relations with. Um, so again, this is where I urge you as the family to go and talk to other people who have been through similar situations that you have. Go seek Al-Anon, go seek your own counsel, because all the feelings you're having will not go away just because your loved one is now getting their own help. So this is where you practice self-care. And look, if you can't go to Al-Anon, which I think you could, because you could even go to online meetings, but if you can't go to therapy, practice some self-care, right? Go outside, walk, exercise, meditate, get the right sleep, get the right nutrition, take care of yourself, get a massage, take a bath, do the right things to care for yourself, because this takes a lot out of you, even when your loved one is getting the help you need. It takes a lot out of you. So this is a time where you really want to focus on giving back and depositing some of this stuff back. And so uh, focus on that for now, while being kind of as supportive as you're able to be, right? You're not going to make or break this process at this point. Um, and then the next time I want to talk about kind of things start to take a left turn, and then kind of getting into the meat of the therapy. So hopefully that's helpful for now.